the report, just your perspective, and then we'll go down the row.
Okay, so my name is Simbo. Well, I did Simbo, but everybody calls me Simbo, so feel free to call me Simbo. I'm the CEO of Avon Healthcare Limited. We are popularly known as Avon HMO. And we came into the industry in 2013. The company was actually licensed in 2012. And I resumed in 2012 as the pioneer CEO. And we came into the industry thinking that, the best way to approach what was going on in there was to really focus a lot on technology. I remember the first presentation I did to the investors in the company. I had 3 pillars. One was people and culture, the second was technology, and the third was brand and marketing. And I don't think I've made a wrong decision, and that is why you'll see Avon HMO being in the forefront of using technology to drive adoption of, health insurance. As it's a great challenge to try and change the way people behave or feel about health insurance in Nigeria. Also, the alliance you see us doing with Piggy Bank is also not a mistake, because we believe that, distribution is key, and affordability is part of what enhances your ability to enter the market and penetrate the market. So we continue to look for alliances with other players in the tech space, even people who are not yet aware of how their tech can enhance what is going on in Nigeria's healthcare sector. So it's a pleasure to be here and to meet all of you, and I hope to have discussions with people later on.
My name is Brian Mesway. I'm the co-founder and CEO of Lifestars Healthcare. So just reflecting on the rest of the conversation today, I think Dr. Ola's presentation was really powerful. And one thing that spoke to me there was the power of the front line, the power of the primary healthcare space. And so we truly believe in that. And a lot of our work is around empowering pharmacies to actually play a greater role in delivering healthcare and having access to the masses. And so Lifestars actually owns and operates a chain of pharmacies, mostly on the mainland. And then on top of that, we actually have programs that we have in place for people that have chronic conditions, especially hypertension and diabetes, to allow them to get access to health coaches, telephonic care, to allow them to get access to discounts when they buy products linked to their conditions. And then we're trying to partner as well with insurers to provide them with insurance to make sure they can pay for their medicines on time and in the right way. So we see pharmacies and that front line as being key to solving the healthcare challenges that we have in Nigeria. And for sure, everyone else has a part to play, but if we miss that segment, we think we'll be in a lot of trouble. So really happy to be here, and also very happy to engage with the rest of the team as the day goes along.
Hi everyone, my name is Abimbola Adibaki. I'm CEO Advantage Health Africa. I'm also co-founder of MyMedicines.com, and I think more people know what we do from MyMedicines.com perspective. But at Advantage Health, what we have found is there is need for an aggregator in the health space, particularly to help to bring the value at the last mile to both the operators and the consumers. One of the things we do is to look at problems and try and find solutions around them. One deep one we're doing right now is to create a platform across the pharmacies that exist in Nigeria. The platform itself is one of the things that then health tech providers can ride on. Because in the absence of the platform, you find uptake being very limited. And then it frustrates your effort because your idea is great, but then how does the operator in Jos or the operator in Nasarawa take advantage of what you're doing? Now, if each one of us is creating virtual infrastructure, it's very troublesome, very wearing. So when you find an aggregator in a space, what you try to do is ride on them, and then you can then leapfrog. So we have proposed to the sector that really in sector-wide collaborations is the way forward, and we're making quite a bit of advancement in that area.
Awesome, thank you so much. And just really quickly about Efrent, I saved my introduction for last. Efrent is a health tech company, and we focus on using health data to help our clients make decisions, whether it be their clinical or their operations. Right now, we are focused mostly on diagnostics and oncology, and we're based here in Lagos. Great. All right, so the second part of this panel is talking about innovation. So Mr. Ngumorcha is going to take that. So I'm focusing on the current state. And when I was asked to do this, I did a bit of research. And for me, I want to start with money first, because the presentation and the report shared how much health startups have been able to raise. So we're going to go a bit global. We're going to go outside of Nigeria. And so my first question, so in the report, it stated that there are 75 active startups, and out of the 75, 37 have raised under $8 million. Now, in a report by Healthcare Weekly, 10 startups in the US raised a whopping $1.7 billion, just 10. And the overall investment in 2018 over the last 2 years was $15 billion just for health startups. So health tech startups. So then my question is, how do we get there? Or can we get there? So I'm going to start with you, Brian, as an investor. How can the 75 active healthcare startups in Nigeria start to compete on the global stage?
Yeah, so I mean, it's a really big challenge, and it's a really good question. And I can speak about it from an investor perspective, but also from an operating perspective. There's something really powerful in following the lead of others. I think as humans, we have a very natural inbuilt character of following what other people have done, we're sheep, effectively. There's a cultural thing that that allows us to kind of find safety in numbers, and investors tend to follow where other investors have invested already and haven't been burnt. So you'll see that really, as we have one or two of these 75 startups that have been identified really blow up and really prove that there is value to be had by investing in Nigeria or in Africa, and getting something out of it, that suddenly there will be an open door and there will be a rush of other investors coming in to try and also play in the markets. I think I saw yesterday that Andela raised $100 billion for their current round. That we should all celebrate, because that basically means that the rest of us have a path that investors outside Nigeria can look at and can say, okay, maybe there's something really interesting here. And we should want Andela to do really, really well. So I think that's the first thing that I would say, is that because investors are sheep, we should celebrate each other, and we should try our best to help the other startups succeed. The second thing that I would say is that, from the operating perspective, is that as our investor base in Nigeria is still being educated, I have both invested as an angel, but I, currently run with my co-founder LifeStores Healthcare. We found that actually when we speak to investors in Nigeria, there's not a lot of understanding of the entrepreneur's perspective of fundraising. And there's a bunch of new, angel funds and VC funds that are coming up that are getting more and more sophisticated, but we have a long way to go. And so, I think, we should all, kind of not just look at Nigeria when we think of investors, but put a lot of effort as well into crowding in other investors from across Africa and across the continent. But I think it's going to be a long journey, and you see all of us working hard to make it happen.
Okay.
It's important that we look at what we can do to kind of expand the size of the market. And every investor wants to see a journey to scale. And that's something that's been very hard for even us as a health insurance company. And we have been growing. We've been growing in leaps and bounds. I dare say we're probably, if not the first right now, we're maybe number 2 in the country. But even then, we struggle with the profit margins. I think our health care sector on a whole has some fundamentals that need to be addressed, both at the regulatory level, but also at the consumer level. I mean, we need to change the behavior of the average Nigerian and their attitude when it comes to healthcare, because people just don't want to pay for it. Hospitals are struggling, HMOs are struggling, pharmaceutical manufacturers are struggling. The only people who seem to be doing quite well are diagnostics, because Nigerians like to diagnose themselves. They believe they can treat themselves. So I think it's important for us to do what we can, all of us that are players in the industry, to work together to beginning to influence consumer behavior. And that's where it starts. Even if the government is not spending as much of the federal budget as they should on health, individuals need to spend money on their health. That's the truth.
Absolutely. Absolutely. Anything to add, Bimbola?
Yes, very quickly, one of the things that showed up in the report is that many of us playing in there are healthcare professionals. Fortunately or unfortunately, what comes with us is first the developmental aspect of what we do, then the business aspect. And if you are speaking to an investor from a social point of view, you almost tend to begin to speak like this is a charity. Healthcare really is not a charity. And if you're asking someone to come and bring investment, in their typical mind, they want to see the ROI, the return on the investment. When will it materialize? How large is it? And what is the opportunity cost? If we don't speak in those terms that they can relate with, they will not invest. How are we painting the value proposition of our solutions? I think many of us tend to do it as though this is for social impact alone. Even social impact can be profitable. If we begin to change our words and begin to speak the language that will make sense to them, I think they will see that this is a sector that can yield and does yield and should yield much more than some other sectors that they are clamoring for. And so the language also ought to change. The healthcare provider or practitioner right now speaks very poor financial language, and then we must improve our capacity in that area.
Thank you so much for that. And that almost segues into my second question, because last year alone, FinTech, according to the Nigerian Investment Promotion Commission, FinTech was able to raise $800 million in Nigeria. That was what was reported on their website. 800 million on their website, on the Nigerian Investment Promotion Commission. So that's a regulatory commission. So why do you, but even at that, FinTech is getting way more attention, which is a very young sector, just like health tech. So that almost answers that, but what can you add to that? How does healthcare, now we're talking about locally, where we're talking about in Nigeria, segueing into what you said, how do we, as healthcare, health tech entrepreneurs and startups, really start to compete even locally?
So I might repeat myself a bit. FinTech is and will continue to leverage what has been done across the sector. Look at the finance sector 15 years ago. It didn't have InterSwitch. It didn't have many of the things that pull together the parties. Healthcare is only beginning to do that. So if you're investing in FinTech, you can see the supporting structures for scale almost immediately, and therefore you're casting your net into an industry that has positioned itself for scale. Healthcare needs to position itself for scale. That is when somebody would then be able to say comfortably, I can bring $100 million and I know that it will not fizzle out and disappear before my very eyes. If we're not aggregating, if we're not working together, if we're not banding together at the back, you might be a forerunner, but you will lose energy very quickly. So think more collectively than individually. Yeah. I think that would help.
Think in terms of an ecosystem.
Yes,
absolutely. Simba?
Yeah, I mean, this is really, it's quite interesting. And it's something I thought about before myself. And I think one of the big differentiators between health tech and fintech is just the huge amount of data that's available in the financial services sector. Yeah, I mean, it's amazing. The financial services sector has been in existence for so long, and from the very beginning of its existence, there's been data. And it's data that is verifiable, that is credible, that has integrity, that, and the regulator as well. I mean, in healthcare, what do our regulators really have? What kind of data do they really have? So for us in healthcare to begin to be able to command the same kind of respect from investors as our peers in financial services sector do, I think we all need to focus on regulation, but maybe that's beyond our powers. But what can we do ourselves to begin to take data more seriously and to start amongst ourselves also warehousing that data in a way that makes it available and transparent and easy for people to access?
Can I respond to something
Absolutely.
that Simba just said?
Go right ahead.
So in every sector, you find regulators catching up. Yeah. So there is a role for the operators regarding regulation. And I think that if we carry the sit-down look position, we will shortchange ourselves. Even when we were having a preponderance of electronic channels in finance, we had to write the guidelines for the regulator. And I remember working in Accenture then. The guidelines regarding ATMs, the business, the operations, the technology, we wrote it there on my laptop. We brought the banks together, wrote it then, and then sent it to CBN. CBN refined it, did all sorts of things, and then sent it back to the sector as guidelines. We are now writing regulation or guidelines regarding online pharmacy for the regulators to take up and then send it back to us. We can't continue to sit back. All of the sectors that were presented earlier, we must take ownership of that part, write and engage them. If we stay back and create this them against us, we won't move far. So I think we must play that role
can actually
in writing.
still override.
We have something to do.
Yeah,
That's
no,
Absolutely.
maybe I need to clarify a little bit on that because, I think the health insurance, regulation as it stands today was actually also initially drafted by operators. So I'm not advocating for us to not engage with the regulators or not point the way. I'm just saying that right now in the healthcare sector, we don't have regulators who are effective, who are strong, who have capacity. Of course, writing for them, engaging with them, and making proposals to them is a responsibility. I take that as a given. But beyond what they are even doing, what are we doing amongst ourselves? How are we collating our data? Are we making investments ourselves in working together and in bringing all the data together? That's
Absolutely.
the challenge to us as operators.
Yeah, absolutely. Because, many things that we can do in health tech space, there's already a blueprint out there. There's already a framework out there. It's being able to understand it and then localize it. And so it's not that you have to develop from scratch, like in the fintech world, you pretty much had to start. But in healthcare, there's so many evidence-based practices, there's so many frameworks done all over the world, but the matter is localizing and making it Nigerian. Brian?
Yeah, no, I think that's absolutely right. I think there's definitely a role for aggregators in the space because I think someone mentioned that there's a lot of EMR record activity right now, and we see that from all over the space. We see people coming into us, providing potential EMRs for us to use. We're building out our own EMR system as well within the pharmacy space. I know that AHA is building something in that space too. There's a lot of repetition and duplication going on. So I think there's a massive role for coordination here. I think one thing we can also learn from the fintech space is that the role the banks have played as not just traditional players sitting back and waiting to be disrupted, but actually getting involved in the innovation themselves as well and investing in those startups. We need to have the larger healthcare players, the more established traditional healthcare players, stepping down and getting involved in the ecosystem as disruptors as well. So I think for us, for those that are operating in the healthcare space, we're looking backwards to see what the hospitals, what the insurers have done over the past 10 years, and we're trying to speak backwards to that as well. Because a lot of our players, a lot of our consumers are actually not that sophisticated. When you create an app and you want someone who has hypertension and is in his 50s or her 50s to use it, that's asking a lot. So you actually have to walk through the existing distribution channels and make sure that they can actually be spoken to in the way that they used to.
And so one of the things in terms of, talking about the journey to scale, being able to show investors how your system or your application can scale. Nigeria is a huge country. And as the report showed, most of the health tech startups in 76 is operating only out of 10 states, out of 36. Now, 55 of them being in Lagos, who are we really building for? Are we all kind of dealing with the Lagos market? But what about Kebbi? What about Kaduna? What about all those places? And so how can we sort of, and I'm going to direct this to you, Mr. Bibola, because you're an aggregator, how do you encourage health tech startups to actually think in terms of scale and make their technologies inclusive and not exclusive?
Okay, I hope I can answer that well. But one way we are doing it, so we've aggregated over 950 pharmacies across Nigeria. They're in 33 states and the X-City. What we simply try to do is sell a message to a partner. Now that partner has helped us to scale on that level. So if you work with partners that already have a presence, and then sell some value to them and include them rather than take all of the shine. I think it helps. Right now, of course, many of us do not work with partners because we don't trust partnerships. I have been burnt, we're being burnt right now, but we're still determined to continue with partnership because it helps scale rather better, much better than if you go alone. So the entities that are in those places do not have much visibility. Therefore, how do you showcase them? Social media right now is very helpful too for showcasing even those who are within your ecosystem. So it helps from that perspective. The third thing that I think I will talk about is the fact that Lagos controls a large proportion of your target. So naturally you should expect that Lagos will be where the center is. But then if you build for long term, you must begin to quickly think of how can I piggyback on others to be able to have that skill. Investors are looking for skill. They want to be able to see Nigeria and not just Lagos. Although some will tell you very quickly, Lagos is fine for us. Just one more point. I think if you see Nigeria as a whole, you will see that the percentage that is not poor, and I say this quite a bit, is more than many countries put together. And that story for me is very profound, and that's why I look at it as Nigeria rather than just, the components. The investors or the operators of ShopRite, when they were coming to Nigeria, they were warned of us. They were told, don't come, that country is really harsh. But what they did was they looked at one statistic. I'm sure they looked at many others, but I'm very quick. They said Nigeria has 70% poor. So if you see that, and as many of us see it, we think that we're a poor country. What they saw was 30% is not poor. And then they did the numbers. The whole of South Africa was just about at 30%. And they said if they can have 700 of their outlets in the whole of South Africa, with its poor, not poor, being about 55 million, then the 30% in Nigeria is sufficient for them to have 700. So you can imagine the way they think of scale, okay? That is what takes you, that's what gives you courage on a daily basis to wake up and see 30% that is not poor as your target. I'm just saying that we should be able to use the numbers and interpret them carefully into what will drive it. But if you see just a small part, you probably get tired.
Absolutely, thanks for that. And so just for time, and so that we can leave enough time for everyone to ask questions, I'll just go real quick, rapid round, final thoughts. We've heard about need to work together, aggregate data, need to celebrate the startups that are already raising money, healthcare or not healthcare, be able to speak the language of the investor in order to compete with the fintech. Any last thoughts?
I think it's also important to aim for standardization. I saw that was one of the points that was raised in the report. I mean, right now, you want to work across multiple hospitals. They record diagnosis and services very differently. And meanwhile, there are global ICT codes, CPT codes that's everywhere else. This is what people use. This is what the healthcare sector uses. And, that's something that we all need to strive for. You have multiple EMR systems that don't necessarily record in the same way or keep data in the same way. For me, I'm all about data first. Everybody that has heard me speak has heard me go on and on about data because it's just invaluable when you have it. And it's what makes everything else possible and what makes you able to scale. So let's just standardize the data and have it in one place.
Standardize. Thank you for that.
So I'll give you another S, scale. So, I think it's linked to standardization, but I think we really have to be able to, in the next 5 years, get to a startup that can claim with evidence that they have millions of users on a daily basis, potentially, or based on the type of startup that it is. I think that level of scale will give everyone else in the space a platform to come into and then offer the rest of their services. So it might be through an aggregator. It might be through somebody who gets EMR rights and becomes the standard there, but that platform will allow the rest of us to be able to then come in and offer other services.
Thank you. Standardization, scale. Are we going to get another S?
Yes.
Great. We had D's from Dr. Ola Brown. Now we have S's.
Sustainability. I just think we should grow for the long term. There are too many, companies that, or startups that think that the journey is a 6-month, 3-month, hooray, and there's magic. I think what you should plan is the same way you went into med school and you knew that it would take you 6 years. Also come into health tech or being a startup and plan 4 years. All right? Yes, the one-off, the outlier might make it and strike it. But really, what does it mean to make it and strike it? Plan long term. That's all.
Absolutely. Thank you so much for that. Give the panel a round of applause. I think it was great. Okay. All right. So I'm just going to say, based on the report, we know there's 70% male startup entrepreneurs. We're going to have to even this out, right? So 3-3. All right? So women, let's represent up in here, okay? So we'll start with ladies first. Ladies first. Right up here, right in front. Please, your name and your question.
Okay, hello everyone.
To who, if it's specific to
Okay, my name is Sheon Timikoleolu. I'm a managing partner of Pavestones, a law practice. My question is really directed at Simbo. I know you said a lot about data and the need to standardize data, but it's really not a question, it's more of a comment. Isn't it more important that what the insights we get from data as compared to just gathering data? Because I think Nigerians can do with more preventive treatments rather than having to always provide, drugs to solve issues when people are ill. So I'm thinking, isn't it more about preventive, gathering data, gain insights from data, as opposed to just gathering data?
Thank you.
Yeah?
Yeah. Yeah, I mean, preventive is really, really important. And earlier on when I was speaking, I alluded to the fact that we needed to even change behavior of consumers where healthcare is concerned. Part of that is also getting people to care enough about their health to, take actions and live their lives in a way that is guaranteed to make them healthier. But you see, even that in itself can give you a whole lot of data. So data is not only gathered when you start curing people or when you start, giving treatment to people. Data is also should be gathered around people's behavior. What influences behavior? What are people listening to? That's why when I said I did the 3 pillars, marketing was one. But for each of those 3 pillars, you actually need data. So data is not something, when we talk about, data that can help this sector, it's not only data that is related to medical treatments.
Yeah. Okay. Thank you. We'll take a gentleman. I saw the gentleman over there. You had your hand up for quite a while.
It's a 2-in-1 question. It goes to the CEO of Avon. Okay, so I happen to be someone who is interested in the health insurance sector. So you said something about the profit margin, which is really an issue. So my question is, what are you doing in terms of, I'm not just saying about you, I mean the HMO providers, what are they doing to reduce the cost charged by providers? Because I found out that from my little research that providers, the healthcare providers, happen to be charging more when it comes to if you're under a HMO plan. And that automatically will now reflect in customers paying more in subsequent years. So what are you guys doing in that sector to see how to reduce the cost being charged by the healthcare providers? Secondly, has to do with the issue of the model we need to use. Because I found out that why most people are paying out of pocket is because of the idea or the mindset that going to the hospital is quite expensive. So my question to you is, what model are you using? Or do you think that using the free bills model will, in a way, bring more people on board?
Using the what model?
Free bills, when I mean that, just giving them a free plan for a period of time. Let them just come and try the experience. Then from there, subsequently, they can, I'm saying this because these people are using it, and I think it's working out for them. Micro pension, though they are not really in Nigeria, though they are coming to Nigeria, but that's a model they're using in Ghana. And so far, they are getting traction from that. So I'm just thinking, don't you think that model could also work in the Nigerian space? Thank you very much.
Yeah.
Thank you, Otobong.
So it would be hard to find companies charging HMOs higher than they charge walk-in patients. it would really be hard, because the whole model of the HMO business is predicated on you being able to negotiate what hospitals charge to a lower rate because you are bringing volume. However, there are some HMOs that are notoriously bad at paying hospitals on time. Those HMOs, hospitals charge them higher tariffs because they don't know when they're going to get their money. So I wouldn't advise you to go with that. HMOs who pay on time get very good rates, far better rates than an individual can get or a corporate organization putting a hospital on retainership can get. Yeah, the pressure on the profitability of HMOs comes from, on the one hand, corporate clients as well as individuals' unwillingness to pay for value. There's a lot of pressure. Many companies just want to be able to tick the box that they have subscribed their staff and their families to a health insurance plan without actually looking at the value and being ready to pay for the value. And on the other hand as well, you have hospitals also putting pressure, and I don't blame them. I tell you, many of them are not making any money. So that's why I say it's a systemic thing. We really, really have to look for how to convince Nigerians to pay for healthcare at the right level. The second part of your question had to do with giving freebies. That would be very, very hard, incredibly hard. Letting people know that there's something to be gained by joining a health plan that takes care of their health when they fall ill should be a no-brainer. But like I said, traditionally and, according to our own sort of customs here, it's a bad thing to imagine you would ever be ill or need it. So it's that whole change that we're having to do through education, and I think we will get there.
Maybe that's why fintech is doing well, because no one wants to lose their money. While health is very reactive, not so much proactive. Remember, you had a
I just wanted to add that one of the points he made about HMOs looking at their margins, one solution that we put in place that about 6 HMOs have adopted now is to look at their chronic meds. And now they're seeing that the chronic meds can actually be taken out of the hospitals, the operators, and sent to the pharmacies so that they get better margins there. And then the HMO itself can post a healthier balance sheet. So there are models in place that HMOs can adopt to get better.
Yeah.
I think the more HMOs open up to these models, because before you didn't have such facilities available, but it's happening now. Also, some conditions we don't need to go to the clinic. Mm-hmm. They can be addressed through the mindset of task shifting to the pharmacy. Yes. Malaria is one of the conditions that really HMOs should know how to engage their enrollees to take first to their provider network of pharmacies. Yes. Where it is addressed, they're tested and treated. And then if there's a failure, there's a second level escalation that can be done. I think if we embrace more of the providers rather than think there's just clinics, we'll get better results with the HMO business.
Thank you for that. So now we're in the middle of the room. So we'll start with ladies first. Ladies first.
Good afternoon, I think. My name is Irene. I'm the Product Success Manager in Telia, and my question is for Abimbola. So you had mentioned you had sort of aggregated 933 pharmacies in Nigeria across the 33 states. So I just wanted to get some more knowledge around that. So what exactly is the information you're collecting? Is it like the inventory? What is the purpose of this information? What sort of challenges have you faced in coordinating all these pharmacies across 33 states? I believe Brian had mentioned standardization. So obviously these are all different businesses that are collecting their data and storing it in different ways. So how are you able to streamline it? And the end product, who is it for? Is it for the customers like me? Like who has access?
Thank you.
So it's a journey we have started, and what we're building is a platform business. And so with the platform, you do 4 things. First, you bring the members, then you introduce the services to them. Then you begin to find and create standards and rules. Then lastly, you matchmake. So right now, I would say we're at the stage where we are bringing the members and we are solidifying their identification with this platform. The second thing we're doing is that we're creating the matchmaking platform. Remember I said earlier that we're building that platform that runs right under their own individual software. If you say, oh, we're going to impose software on them, it's a hard sell. It will happen eventually, but it's a hard sell. So what we're doing is we're working with all of their service providers regarding their own POS software solutions and speaking to them about opening up their system. When they open it up, then we can use APIs to interlink and then speak the same language. Then data begins to drop naturally. And we're already in partnership with IQVIA, for example, to translate that data into what the operators can use, where pharmaceutical manufacturers can, use better, and so on and so forth. Ultimately, to come to your benefit. If their inventory is better managed, they're sourcing right, and they're able to place the medicine that you need in your area, then ultimately it will get to you. But our focus is strengthening them. In matchmaking, we're also beginning to bring services to them. They're able to access loans better. They're accessing this access to this market, this HMO market, because now enrollees are coming to them in a way they wouldn't have come to them before. Mm-hmm. And lastly, they're accessing skills. So those are some of the services that they're having. They are near expired medicines and now going through an app where they can showcase them and sell to one another faster. And the last one was about standards. I think the standards should be put up last. If you put too many entry barriers, if you're building a platform business, what you find is low uptake. So we've reduced the barriers, get them in, and then you raise the barriers. To me, that's the business sense.
Thank you.
Just a couple of quick things to add there. So, I mean, we've actually engaged, I think, with AHA, and one of the matchmaking services that that are of interest to a lot of pharmacies actually is either buying or selling your pharmacy. So you'd be surprised. In lots of markets, you have an open platform for somebody who wants to sell their pharmacy, to sell it out. In Nigeria, it's a very opaque market. So there's a lot of room for actually that trade of assets. That players like aggregators like AHA can be involved in. The other point to make on standards is we think about POS software as, okay, pharmacies have 1,000 POS softwares that you have to all create APIs to feed into, but actually a lot of pharmacies don't have any software. They use books and paper to write the orders that happen every day. So there's actually a penetration question as well of trying to get software that is basic enough and cheap enough or free that allows people that are currently still in the Stone Age to come in and start digitizing their data. So that's part of the challenge that is also being faced by the sector.
Actually,
Thank you so much.
I have a pharmacy for you. I just inspected one before coming here.
Don't worry, we're going to meet
Let's take it
outside.
offline.
Money-making business.
All right. So one more question on the middle side.
Yes.
Chedo has, okay.
Okay.
Don't worry, we're still here. So if you don't get your question asked, the panel will still be around. You can ask some questions afterwards.
Hi. Hi, my name is Henry Mascott. I'm the founder and the CEO of Curacao Systems. So, I sell EMR and enterprise software to health insurance. And with the presentation, when the reports were going on, there was something said about EMRs being all over the place. But being in the market, we also know that most of these EMR vendors don't actually sell to the real people, right? They sell to small hospitals, mid-tier hospitals. Most of the softwares that most health insurance companies use, especially the big ones, they buy from outside the country, right? So when you do the numbers, we're actually paying Indian companies, American companies, so hundreds of millions of naira that could be in the economy and help grow these startups are all going out, right? My question is to the CEO of Avon, right? You've talked about supporting, you've talked about data. How are we going to do all these things if the softwares you guys use all come from outside? How are you supporting local startups to actually grow if the money is being repatriated to other countries?
All right, thank you for that.
Yeah, very good question. First, the software we use now, we locally developed it. A local firm developed the software we use in Avon. We've used it for 6 years. And we made the decision not to go and buy any of those kind of, world-class leading HMO options out there in the beginning because we thought we wanted to understand the market and understand the business, and we were looking to do something different from what other HMOs were doing. So we built one from the scratch and worked with a local developer. So don't make assumptions. However, I also have to tell you that given what we know now, we have found a match for our needs in the open market globally. I don't believe that we should be bound by what is available here. There should be no restriction. So what I would say to you is, and other developers, is to have conversations with HMOs. There are many other needs we have which you can help us lay on top of what we are using as the core software. There are so many opportunities. I have a long list here. I'm hoping to, talk with as many of you as possible after, after this session.
Absolutely.
There's so much room.
Okay.
Of what can be done, not just with us as an HMO, but with other HMOs as well, and across the entire value chain. Yeah. I mean, I'm not a doctor, I'm not a medical professional, and I'm not a pharmacist. I'm actually a lawyer turned business person. So, I see things that are from a commercial angle. I used to be in financial services as well. I've been in law, FMCG. So, there's a lot that the healthcare sector has to offer people who are willing to come out there and just be creative.
Thank you. Thank you so much for that. So spend some time to talk to your potential clients. They might not need an EMR, but they might need something else, all right? So we're on the last part of the room. Can we get a ladies first? I see Dr. Rode.
Hello, everyone. Good afternoon. I'm Chiki from HelloCare. For the most part, we spent our time comparing health tech and fintech, and even though I think it's quite unfair because fintech has some specific features that makes it different from health tech. In that, in fintech, you want to exchange money from one person to another, and so the money is already there. But in healthcare and health tech, people do not feel like they should spend money on healthcare. And like the CEO of Avon mentioned, people have to be made to spend. People have to spend money on healthcare.
Absolutely.
So my question is to you: how do you make people, based on the last pillar you mentioned, that you use at Avon, culture, seeing how we are here in this part of the world, how do you think we can make people spend more money on healthcare?
Okay, so part of what we're doing in Avon is segmenting the market and trying to understand, what Nigerians think in the different buckets that we have identified them to belong to. So there's a certain category, I'll use age now because that's one of what we use for the segmentation when we do our discussions on our strategy. So you have people who mostly can afford our health plans on their own now without thinking too much about it, being between the ages of about 30 to about, and above. But after 55 or 65, if they haven't taken very good care of their health, they're so ill that it would very, very, very risky to want to give them health cover because we also even don't have the data in Nigeria to price properly to provide health insurance for those category of people. So you might want to say, and this is, no competitor is here, but it's an open market. They should know if they don't know. That you could focus on that, that segment of the market, and then you talk to only people who can afford to buy your healthcare. And at the end of the day, there are the people who won't because their own culture is so deeply embedded in them. They have matured thinking like that. Or you could face the younger segment, and you could go from the ages that are between 18 to 30. Or 35, who you still have an opportunity to mold how they think about healthcare. So that is, how are we doing it? How we're doing it is beginning to engage with that category of people in their own language, in their own communities, and their communities are mostly virtual communities, and also relate with them in a way that enables them see the advantages, because what we sell is healthcare. If you have it, it's not a tangible that you can say, I've spent money, so now I have this. But this sector, tech sector, also plays a role in helping them see immediate gains. So your blood pressure used to be this, now it is this. So we strive to give them value that is measurable.
So final thoughts, and then we'll end, and then you can ask the panel questions. So Brian, because you're the only male, I'll let you have the closing thought.
Yeah, absolutely. So just to, I think it's a really important question around how to get people to pay more. So let me just touch upon that before I close out. So in our pharmacies, we have on a daily basis people walking in with an idea of what they already have. an idea of what products they want to buy for that. And it's the role of the pharmacist and the role of the team. And it's actually not just their role as employees, but it's their role as healthcare professionals to educate the customers as they're walking in. And somebody mentioned preventative services, I think a little bit earlier, preventive care. And we're finding that that actually it resonates if you tell the story in the right way. So if you see yourself not just as a reactive healthcare professional, but a proactive advisor to your clients, there's a lot of room for value there. And pure example is, so we launched a program for people that have hypertension that they pay 1,000 naira a month to be part of. That they don't really get any value apart from that 1,000 naira, apart from the fact that somebody calls them every week to ask them questions about how their BP is progressing, to give them tips on what to eat, what exercise to do, how to manage their stress. And the value they get from that, they tell us that is better than the drugs that they buy from us as well.
Absolutely.
So I think there's a lot of room for that kind of education and awareness building.
All right, thank you so much. And that's the end of the first panel. We've heard that we need to standardize. We talked about scale and finally sustainability. So please, a round of applause for the panel. Thank you so much, Ms. Simbo, Brian, and Bimbola. Thank you.